that's not possible. But we can say the levels are now so low. So as the Secretary of State said, the data last week before last, was on average in our communities, you would have to meet 1,700 people before you came across a case of infection. So it's trying, I think, to get that perspective and proportionality into people's understanding. And so the issue here is the epidemiology changes, so it's whether you meet the disease or not. For individuals, they will have a different risk if they meet it, but it's not actually, I think everybody quite reasonably is seeing it from their own disease perspective, where what we're saying is the epidemiology has changed. I think the bit that will help people going forward, we're coming up, we hope, to a sustained period of very low infection. I'm actually more concerned, I think, about if we get to the winter and we have cold weather and everybody hasn't continued to socially distance and keep on top of this. But what we will have, which will help employment discussions then, is hopefully this new assessment, a new tool, if you like, to support discussions. And what that will do is give that very individualised discussion with your GP or with your specialist, which will account both for the underlying conditions and some of the other attributes. You know, if for example, you are from a Southeast Asian background and are a young footballer, for example, your risk would be very, very low indeed. But if you are elderly, if you have other conditions, obesity, diabetes, or what have you, age is actually one of the biggest variables. But all of these things need to be factored together for your own individual assessment. So I think now is as safe as it's likely to be for a while. When it gets back to the winter, I think we're going to have a different tool, and that will help both the individual and the employers.
Thanks very much, Oliver.
Just one other quick one, if it's possible.
Sure, go ahead.
You mentioned about the retooling, essentially, this shielding list. Does that mean that you're developing the capabilities to instigate regional shielding lockdowns, for example?